Hello, everyone, and welcome to USMMA EMS Training Online. Today's topic is COVID-19 response. This is the EMS viral pandemic triage protocol developed by New York State because there have been an excessive amount of patients transported to the hospitals during this pandemic. And to keep the hospitals a little less overworked, they're giving the providers the tools to limit the amount of patient transports. So the first step, in simple terms, you will ask the patient and yourself, sick or not sick. During a pandemic, all patients will be screened for the following. Screening will occur at 6 feet. So from 6 feet away, you will screen the patient if they are having any signs and symptoms of influenza-like illness, that being a fever greater than 104 or subjective temperature. Is the patient say they're burning up? Sore throat, nasal congestion, post-nasal drainage, that being mucus coming down in the throat. Shortness of breath, signs and symptoms of gastrointestinal distress, wheezing, cough, headache, fatigue. Patient has none of these. You may treat and transport to the hospital. If the patient has a singular one of these, you will follow the protocols and don PPE before initiating close patient contact with this patient. For USMMA EMS, we will don N95 with a surgical mask over it, gloves, gown, and eye protection. You will limit close patient contact to as few providers as possible, and every other provider should stay outside of 6 feet. Other providers wearing PPE, only the providers with the PPE on should stay within close patient contact. As per the protocols, close patient contact means within 6 feet of a COVID-19 case for a prolonged period of time. Prolonged meaning around 10 to 15 minutes. So after you've done the PPE, you will perform an assessment. Is your patient greater than 65 years of age? Temperature greater than 100.4. Respirations greater than 22. SpO2 less than 95. Heart rate greater than 110. Systolic less than 100. Or altered mental status. If they have any of these, you will transport and treat as per BLS and ALS protocols. If they don't meet these, you will go on to the next one. Obtain the patient medical history. Diabetic, pregnant, cardiovascular, pulmonary, immunocompromised, HIV, chemotherapy. If they have any one of these, if you checked yes in these boxes, follow BLS and ALS, EMS treatment protocols, and transport accordingly. If they did not check the boxes in the medical history, it will go down. Does the patient have a secondary or underlying medical condition other than or addition to influenza-like symptoms? The example they use is chest pain concerning cardiac cause, or CHF, or any other examples. Yes. Yes. This patient has these underlying or secondary causes. Follow standard BLS treatment and transport. No. So let's say you did transport this patient, or you are considering transport. Consult medical control for difficult or unclear situations. If indicated, transport in accordance with the policy. For patients who did not meet the criteria listed above, you said, no, 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 no. This patient meets criteria for non-transport and or treatment in place. Provide the patient with the hotline number, the COVID-19 patient handout, which will be in the next slide. If the patient insists on transport, contact medical control for guidance. Let the medical control know what's going on. Let them know the patient really insists on going to the hospital, and ask them what you should do. This is the handout you'll give to patients who meet the criteria for non-transport or treatment in place. And it just tells them a list of information that they should follow and guidelines they should go by, as well as numbers for hotlines. How to protect yourself. Obviously, we will don the PPE for these calls. And for all calls, we will wear N95s with surgical masks over it. In these calls, we will have two EMTs, mostly the crew chief and a technician. Don all the PPE, and then we will have the driver close the door behind them so that they will limit the amount of COVID-19-ness getting to the driver. Crew will sanitize everything, pens, PCR boxes, BP cuffs, stethoscopes, literally everything in that bus. For EMTs who did not get with close patient contact, you can reuse your N95 mask. So once you do go to this COVID-19 case, North Shore has this beautiful equipment called a Clorox 360 disinfectant sprayer. You let the EMS liaison know during the day, and then hospital security know towards the night. And that's how you schedule one of these. You can use, this is at North Shore. So use this Clorox Total 360 to decon the bus for any of your suspected COVID cases. Read the protocols located in the COVID binder in the bus and the crew chief bag. Obtain the machine, don full eye closure equipment like goggles, and spray the surfaces with slow sweeping motions inside the bus, everywhere, all the surfaces. It's electrostatic spray, so it repels itself and sticks to all surfaces. Follow the protocols, stay safe, and do not get sick. Thank you all.